Hi, everyone. Thank you for joining us today. I am so excited that you're here with us. We have a full line ahead. My name is Dasha. I'm your pre-health advisor and moderator for today's pre-health summer workshop, Introduction to Health Career Pathways. And so joining me today is Lauren. She's our senior peer pre-health advisor, UH alumna, and current physician's assistant student at Hawaii Pacific University. She's supporting us with tech today and will also share her student experience later in the session. Just a quick few housekeeping reminders before we begin. Please keep your microphone muted until Q&A. However, if you feel like you want to type in questions and you don't want to wait to the end, you can do so by typing in your questions in the Q&A. And then hopefully during the presentation, we will be able to answer some of those questions and get them answered. And if not, we will try to get them answered at the end of the presentation. And again, if you can also just keep cameras off to minimize distractions. And also know that the session's being recorded, so we'll send you out a link afterwards. So just want to take a quick moment to talk about why we're here today. This session is all about exploring the many professional pathways in healthcare. So whether you're drawn to working with patients, in labs, with animals, research, in a community setting, or internationally, there's really something here for everyone. If you have been to PAC or if you're not familiar, here at PAC, we do advise and support students pursuing careers in medicine, physician's assistant, physical therapy, occupational therapy, dentistry, pharmacy. We also collaborate closely with other healthcare programs such as nursing, veterinary medicine, and a lot of other health-related programs as well. Many of these roles that I mentioned share some overlapping responsibilities, such as patient care, diagnostics, health education, but as you know, the paths to reaching them and the day-to-day experiences can look different. So that's why we brought together this panel to help you better understand not just what each profession does, but why people choose these careers and how do you get there and what you might want to consider as you explore your own steps and the next steps into healthcare. So today you're going to hear from both professionals and students who will help you think broadly and intentionally about what path might be the best fit for you. So we're going to begin our panel presentation, and I'll introduce each speaker as we go along. So first up, I have Dr. Camelin Masuda. She is part of our DKIP program at University of Hawaii in Hilo, representing pharmacy, and she's going to give a brief overview. And she'll need to leave just a little bit early, but no worries. We also have Dr. Nicole Young, who will join us around 2 o'clock to continue the pharmacy conversation during Q&A. So Dr. Masuda, I'm gonna give you the floor.
Thank you so much. Thanks for having me and thanks for attending today. It's all exciting times when you're trying to figure out where you want to go and what pathway would be the best for you. As a pharmacist, I actually went to the University of Hawaii at Manoa for my undergrad degree, and I actually worked for a while before I found pharmacy as my pathway. And I'm excited to talk with you about pharmacy because even when I was in undergrad, I didn't really know all the opportunities pharmacy would have for us. And so our school is named after Daniel K. Inouye, as listed here. And it's a wonderful place. And I wanted to, show you a little bit about the building and behind me in my scene. This is actually the building in Hilo. It's a beautiful building. We just had it built about 4 or 5 years ago. And so we wanted to talk to you a little bit about pharmacy. Pharmacists, as you probably kind of already know, are the medication experts. So you are a valuable member of the healthcare team to help people. So if you really are interested in helping people, have some interest in science and a little bit of math skills, pharmacy is something that would be appropriate for you. The one thing I love about my job is helping people understand medications, understand why they're taking them, why they're recommended for them, and also to help prevent them from having problems from their medications. And so keeping patients safe is another valuable point of our profession as well. And as pharmacy has grown, There are different types of pharmacists that are pharmacy areas that you can practice in. So I wanted to talk a little bit about that, but also wanted to show off our current fourth year class as they got their white coats. And so they had a white coat ceremony there. So this is kind of what we talked about a little bit. I didn't want you to have to read the slide. I thought it would be more interesting to look at our students that we currently have in our college. But what I wanted to focus on is you are probably most familiar with pharmacists at your Longs or your Walgreens or Walmart or Times, whatever pharmacy you or your family members may have gone to. So that's the most common type of pharmacy role that we have, is in a retail setting where you prepare and dispense medications for patients. And part of it is to make sure you look for any types of drug interactions, help patients understand when's the best time to take their medications, if it might interfere with when you eat with food, and those types of things. But as you can see here, there's many different opportunities for you as a pharmacist, and that's really what interested me, especially once I got into pharmacy school. So I'm what's called an ambulatory care pharmacist. So what that means, ambulatory care is like doctors' offices or like outpatient clinics, as well, dialysis centers. So I work in a primary care doctor's offices in the Pearl Ridge, actually. It's under Polymomy, and it's through the School of Medicine that we have physicians that see patients, but I work alongside with them as well. So I help make recommendations for appropriate medications to treat different disease states. I alleviate any problems patients might have at the pharmacy if they're having problems with a drug that's not covered by their insurance, or even cost, trying to find lower cost options for patients. I also, as a pharmacist in the clinic, have the opportunity to meet with patients one-on-one. And I have more training in managing diabetes. So I have to leave early because I have a patient I need to talk with about their diabetes and make sure that the medications they're on is helping to keep their blood sugar levels at an appropriate level. So sometimes we can titrate their medications. If it's not enough for them to lower their sugars enough, we can order labs for them to make sure they're safe on their medications as well. And that's the part I really enjoy about my job, is that face-to-face interaction with patients and actually really talking about how they're doing and how we can adjust things to improve their health. But we have pharmacists in the hospital. Hopefully you've never had to see us in the hospital, but we have pharmacists who help adjust medications, especially for critical medications that are needed when someone has a heart attack or a stroke or has a severe infection. But other things, as academic, I have a dual role where I'm also a teacher in our College of Pharmacy. So I help teach students who want to become pharmacists as well. And we even have pharmacists in all different types of settings. So even in the prison systems, people in prison need healthcare too. So we have pharmacists who help dispense medications there also. So there's a wide variety of options for you, even as a pharmacist. Our main thing is talking about medications, but there's many areas where there's need. So this may be more what you want to look for. This is a big plus with pharmacist salary range is anywhere between 120,000 to 160,000 annually, and that's coming right out of the pharmacy school. And you do get a doctorate degree once you finish the program, which is great. The challenge there, just to be honest, though, is you get salary increases with like cost of inflation or if you become a manager. But big changes in salary don't really occur because you already start off with a high salary. Additional requirements besides your doctorate is you need to be licensed in whatever state that you're practicing in. And it's typically a license exam you have to take about pharmacy related information, and a separate one about law, because there are a lot of laws restricting certain medications like narcotics and opioids that you've heard about in the news. But I really wanted to showcase our students. Our college is a very small college, so we do get to know our students very well. And so it's very helpful for students who prefer the one-on-one attention. But I do have an exciting announcement too. We have an in-person four-year track. So this track and the pictures of these students are those that were in this track where you come to Hilo for 4 years and take your classes. It's didactic courses, meaning lecture type courses for 3 years. And then last year, you do different rotations in pharmacy settings, which you can choose different areas like on Oahu or Maui or Kauai or even on the continent. But starting from the spring of 2026, we will have an extended online track, which will be 5.5 years online, mostly online. There will be times where you need to be in Hilo as well to learn different skills like compounding, making different types of medications, usually for about 2 to 4 weeks in Hilo each year. And then the last year and a half will be experiential rotations where you might do some in Hilo, but can do them other places as well. So College of Pharmacy in Hilo, main points for it too, especially if you're already in Hawaii, on Oahu, it's not too far away from here. It is in a rural setting, so it really gives you an opportunity to meet healthcare needs where they're the greatest. And it is a great small community where you get to know your classmates and the community around you, as well as have a very supportive environment. So that is my presentation. I apologize if I went over time, but there's a lot I want to share and only 5 to 7 minutes to do so. But as she mentioned, Dr. Young will be joining us later. So if you have questions, you'll be able to ask her as well. Thank you.
Thank you so much, and you did great as far as the time. So thank you so much, Dr. Masuda. Up next, we have Christopher Waiamau, who is our admissions advisor at UH Manoa School of Nursing, and he's going to provide a high-level overview of the Bachelor's of Science in Nursing program and share information about admissions requirements, pathways, and what students should consider when preparing to apply. But before he begins, just a quick note, we do have another nursing program that is called the Graduate Entry Nursing Program. Justin Lau, who is a program coordinator, couldn't join us today, but as a former graduate entry nursing coordinator, I'm happy to help answer any questions about the GEPN or the DNP track during Q&A. But again, for the most up-to-date information, I do recommend following up with Justin directly. Okay, Chris, I'll turn it over to you now.
All right, thanks so much, Dasha. Hi, everyone. Thank you so much for joining us today. Let's talk about our nursing programs here at UH Manoa. I'm going to go ahead and share my screen. It might take just a second to load there, but okay, it's still loading. Okay, I think it's hopefully loaded now. So this is our nursing website. We're going to just go over real quickly a bird's eye view of how to kind of navigate one particular area here, the prospective students tab. But what I like to do, just to kind of get students acquainted with our website here, I like to just ask them a quick true or false question. So this is going to be a rhetorical question. You don't have to type your answer in the chat or anything, but I'll usually start off with a true or false question. And it's simply this: is there only one nursing program here at UH Manoa? And I'd say the responses I get, 50-50, right? There's only two options there. It's either true or false. But the answer to that question is false. There's not just one program. A lot of times I think people kind of conflate school, the word school and program. There's one school of nursing here at UH Manoa, but there's many different programs that we offer under the school. And I think that's true for most nursing schools. They usually don't just have one program, which is actually great news. If you come to us and say that you want to be a nurse, you want to go into a nursing program, that's great. And what's even better is that there's more than one way to do it. If the end point of what your goal is to become an RN, a registered nurse, is not just one way to do it. There's many, many different ways to do that. Even right here at our campus here at UH Manoa, there's many different programs that we offer for nursing. So we're going to talk a little bit about each one. We're not going to have time to really go in depth about the admissions requirements for each program, but I can give you a quick surface overview of them. Okay, so like I said, if you're just going to come over to our website here at nursing.hawaii.edu. If you remember nothing else, remember that. That's our website. But right here under prospective students, you'll see the lineup for all of our individual nursing programs. So we have them broken down by undergraduate and graduate. And as Dasha was talking about, we do have graduate programs too. If you're not really familiar with the difference between the two, it just refers to the degree type. Undergraduate means either associate's or bachelor's degree, and then graduate refers to master's or doctoral degrees. So we don't offer any associate's degrees here at UH Manoa. For that, you would have to go typically to a community college. Some private institutions might have associate's degrees too, but for us, our lowest undergraduate degree that we offer is at the bachelor's level. So we have four different ways to do that. We have a high school route, a traditional route, this is something that's very common across most nursing schools. They'll have a traditional VS and nursing route. We have a fairly new one that we're offering with one of our sister campuses at UH West Oahu. We just started admitting students for that one back in 2024. And then we have an online route too. Okay. Now, I think for everybody on the call today, nobody here is still in high school, right? I think everybody here probably graduated from high school already, right? So this is in the rearview mirror. But I will say that this is probably the hardest, the most competitive program that we offer here. Why is it so competitive? Because it receives the most number of applications. This past cycle, we hit, I think, 606 applicants for that program, and we had enough seats for just 20 students. So that's an acceptance rate of about 3%, little over 3% just for that high school route. Compared to the traditional, which is an acceptance rate this past cycle of about 11%. So it's less competitive just based on the percentages, but still pretty tough to get in. The West Oahu route, I don't quite remember the acceptance rate for this one, but it's considerably less competitive than the traditional route because it's so new. I think eventually those numbers will equalize. And then finally, the online route. This one is actually not competitive for admission. A lot of students kind of look at this one, but there's a catch for this program. Before you can enter the online route, you have to get an associate's degree in nursing first. So again, for that, you would have to go typically to a community college, which is usually competitive. Even at that level, it's still going to be competitive for admission. So yeah, that's the four basic ways to do it. Here's what we're looking for, just in general. For most of our undergraduate programs here, we're looking at two things, academics and experience. In terms of academics, we're looking at your GPA, and then we're also looking at how you're performing on a specific test that we require called the TEAS exam. It's kind of like the SAT, but on steroids. So it's a standardized test. And then we also look at experience, which you will demonstrate based on a personal statement and then a resume. So if you want to be competitive for the most common route is going to be this one, the traditional route. I would say an average GPA of about 3.8 is usually consistent. That's kind of the average for most admission cycles. Test scores for the T is around maybe 90% or so. And then for experience, you want to work and or volunteer. Anything that is healthcare related is going to be particularly good too. So it doesn't have to be purely healthcare experience, but that's kind of the trifecta there. High grades, high test scores, and experience. That will allow you to be competitive for the traditional route, the West Oahu route, and also if you're applying to some of our community colleges here in Hawaii too. So anyway, that's just a really quick summary of the undergrad programs. And then for students that are not applying to one of these, or if they don't get into one of these, they can also look into our graduate programs too. Okay, I think that my time is up. So anyway, nursing school is tough, it's competitive, but if you're meeting the benchmarks of the competition, you can prepare yourself for multiple nursing programs here and at other colleges. Okay, I yield back my time.
No, thank you, Chris. And just one more thing to add. If you decide later on that nursing's for you, as Chris said, and you have a bachelor's degree, you could consider the graduate nursing program. And just a couple things to highlight. There are no TEAS tests involved in that. You can have a degree in any specialization, but I do recommend, again, it is highly competitive. So the GPA still definitely counts. And also any type of experience, if you can, that would be helpful. But again, a lot of our career changers and people that have decided to do nursing later may not have all of that. One thing you cannot have is a nursing background if you are looking at the graduate entry nursing program. But again, if you have questions about that, we can talk about that some more later in the Q&A, or you can also schedule an appointment with Justin or feel free to talk to us at PAC2 as well. Alrighty, so thanks again, Chris, for everything. And now I'm going to pass this along to Lauren and Dr. Well, actually, I think who is up? I'm sorry. We're going to go right into our PA. So it is Lauren, who again is a current student, and then also Shayna Inafoku, who is the assistant professor and director of admissions at HPU. They're going to provide the insights into both the student experience and admissions process for our PA program. So I'm going to let Lauren and Shayna take it away. Thanks so much.
Thanks, Dasha. Like you said, my name is Professor Anafuku, Director of Admissions and Assistant Professor with the HPU PA program. I think, this might seem like a whirlwind hearing each of these programs. So I would just say come to our individual webinars, make appointments with our admissions advisors, and look at our websites to, learn more. But I just want to go through some things really quickly and give Lauren, space, just as Dasha is really proud that, Lauren was here, not in your seats, not too long ago. Now she's one of our PA students at HPU, and we're just really proud. So just wanted to go over, what is a PA or a physician associate? So PAs practice as a healthcare on a healthcare team. And sorry, something is going on my end, and I cannot see the slides. One second.
And we could also just FYI, Shana, we could see it just fine when you
Oh
have it up.
yeah.
Yeah.
Okay. Let me try again.
Yep,
Is
we
that
can see
working now?
it.
Okay. So a PA is a licensed medical professional who can provide direct patient care. They work in virtually all specialty and primary areas. And the specific duties of a PA are determined by the scope of not only their supervising physician, but also state law. They can provide many of the same services you can think of as like what a primary care physician does. And we practice in every state, in virtually every medical setting and specialty. And with an increase of shortage of healthcare providers, which is something I think you'll hear a lot about, PAs are really valuable members of this team-based approach to providing high quality care to many populations and communities across the country. So on a typical day, the roles and responsibilities of a PA might include conducting physical examinations, diagnosing and treating illnesses, writing prescriptions. We also order and interpret medical tests. We counsel on preventative healthcare measures and educate patients and their families. PAs can also assist in surgery, perform procedures, and conduct hospital rounds. I like this graph because PAs are trained as generalists, we can practice in virtually any specialty area of medicine. This spans from a variety of roles and specialties. And I think the versatility of the PA is a big advantage and a real draw point to the career. In order to specialize in some of these areas, particularly the surgical specialties, you may have to do a fellowship or a residency. But really, if there's an area of medicine that you're interested in, you can practice in it. Overall, it's a great gig with great job satisfaction. And because of the role that PAs play in fulfilling healthcare gaps, there's also excellent job growth, which when you're choosing a profession is something that you always look at. So how do you become a PA? So while everyone's path to becoming a PA is a little bit different, and we'll get one perspective from Lauren in a bit, more or less, you're going to first have to get a bachelor's degree and complete some science prerequisite coursework. It's not to say that you need to major in, a science field, but most do because of the prerequisite course. The prerequisite coursework aligns nicely with certain majors. You're also going to want to get clinical hours. This varies as well from program to program, what counts, what doesn't count. So again, go look at the websites. But some examples, especially from our first cohort, lots of medical assistants, EMTs, nursing assistants who get certain training and experience, and then they move on to PA school. Then you're going to complete a physician assistant program at an accredited program where most programs are 2 to 3 years. The first half is a didactic medical education, and then the second part is a clinical education where you rotate between various fields. Then you're going to sit and pass your national board exam, and then you'll need to follow certain state requirements to practice in a certain area. Like most of these medical careers, you're going to need to update your certification. This might be continuing medical education. And then for PAs, we do this, our CME count every 2 years, plus recertification or another board exam every 10. I show the slide, like this 5 minutes is not enough to go into each of the requirements for PA school in general, nor, our individual program. But if you're still in that area where you're not quite sure where, you're heading, or if you're a fourth year already and you think you're behind the game, probably not to even, to consider PA. You're probably taking a lot of the classes, that most PA schools require. These are the prerequisite course equivalents for our program. So can take a quick look at this. And this is also on our website. There's a document that shows for all UH schools and community colleges what the course equivalency is. So where can you go to PA school? There's over 300 PA schools across the United States. Each one is great, provides, something that might align with your personal mission, vision, values, goals. I'm proud to say that HPU is home to the first homegrown PA program. University of Washington MEDEX also has a satellite campus in Kona. So we do have some great local options. For HPU, we matriculated our first class in January 2025, and they'll graduate in December 2026. Lauren is a part of that class, and I just wanted to give time for her to share a little bit about her story.
Thank you. Just really quick, because I know we're all like short on time. Hi, I'm Lauren. I'm a PAC peer advisor, but I'm also a part of the inaugural cohort. And my biggest advice to you guys is really listen to what everyone says and don't rule out any field just because you think you might not like it or you don't know much about it. When I started UH as a freshman in 2018, I had like tunnel binocular vision on being a doctor. But when I finally branched out and considered everything, all of my options, including PA, all I had to do was shadow a PA for 8 hours, and my world turned upside down. I fell in love with the profession, what they do, and everything that comes with the field. And now I'm proud to be 1/4 of the way done with my PA education. So you never really know where you'll end up, and don't be afraid to really like reach out and get out of your comfort zone a little bit. But like Professor Inafuku said, if you have questions, like go to their webinars, reach out to HPU specifically. If you're not too sure what you want to do, I'm a peer advisor. Dosh is an advisor. We have so many great and qualified people that you guys can talk to help with your journey. But that's short and sweet, a little bit about me. But I hope you guys got a lot of our quick presentation. Thank you.
Thank you so much, Lauren and Shayna. So next up, we have some more Hawaii Pacific University folks here. We have Dr. Robin Audi, Las Vegas, and we have Dr. Pierce here also representing Honolulu for our occupational therapy, Doctor of Occupational Therapy program. And they're here to share what makes occupational therapy such a unique and rewarding profession. I'll go ahead and turn it over to you guys.
Okay, well, thank you for having me. I just want to make sure that you could see my screen.
You're good.
Okay, great. Well, thanks again for having me. I am here to represent both teams. We have a Honolulu program, and we also have a program in Las Vegas. So I am the program director to the Las Vegas campus, and here's a picture of Dr. Pierce, who is the director of admissions of the Honolulu group. So first we're here. First, I just want to let you know, we want to talk about first, what is occupational therapy? And I will break that down. Like what I think a lot of the times people hear occupational therapy and they think, oh, I'm going to get a job. While that might be part of what an OT might address, but the occupational therapist is really addressing occupations, and occupations are meaningful activities that identify with the individual. So there are activities or things that one has to do, needs to do, and wants to do. The therapy perspective is obviously to support returning to that previous level and participation and support their ability to participate in those meaningful activities and also support their well-being.
So sorry, Dr. Audi. We see the presentation presenter view, so we see your script on one side and it's really tiny
okay.
on the other side for the
So
slides.
let me
Sorry
do this
about that.
Okay, well,
Thank
I
you.
did wrong screen. Here we go. Okay, let's try this. How's that?
There you
Yes,
go.
perfect.
Okay,
Thank
great.
you.
Awesome. So here are some examples of occupations that we do every day. Think about all the elements of what you had to do to basically go to school or go to work. You had to be able to take a shower and brush your teeth and do what we call, those are activities of daily living, and they're called basic level. And those are the things in which we are able to function. So we had to be able to get into the shower and take a shower and be able to move our body in a way and even understand, cognitively understand that we had to clean ourselves and pick out the right clothes for us to get dressed every day. Those are all part of what we call those basic level occupations. And then we also socialize with our friends. We call them up on the phone. We engage in social media. We view social media, participate in that. We even create social media. We also have to take care of our loved ones, and that might even include taking care of your fur babies as well. And then certainly as a student, you have to be present for class. You have to be able to take notes. You have to be able to pay attention to the presentation. So those are all elements or essential pieces that you do each and every day. But imagine for just 1 second if something was to change that, such as an injury or some sort of disruption in your life. That's where occupational therapy is going to help address how can you recreate that? How can you accommodate and use equipment to participate in those meaningful occupations? So as occupational therapies, we help individuals do what they need to do and want to do. And for children, that means including how do they participate in play. So maybe it's adapting the play object so that they can grasp the object, or maybe we can make it more lively by having a push button that they can easily access to get the same result. And then we also encourage meaningful aspects to one's person's life throughout therapy. So the picture on the bottom, we see somebody using a specialized hand device to learn how to drive, and it basically allows a person that cannot grasp a steering wheel. So an occupational therapist that is specially trained and is able to prescribe that piece of device and train a person how to adequately and safely use that when they drive a vehicle. So who do OTs work with? So OTs work with all types of people from birth all the way to older adults and in all sorts of different settings. They may work in a school-based setting. They may work in a rehab setting where we work very closely with other medical practitioners such as physical therapists and speech language pathologists. They also may work in outpatient and even in more unique sections or populations. They may even work with the person in their job, wherever that job may be. So why choose OT? So here are just some highlights in terms of the prospect of becoming an OT. It does have a positive outlook, as does many of our other partners here and other professions. It is the number 4th best healthcare job. It's the number 19th out of the 100 best jobs. And we see a gradual growth over time. And generally, because of the diverse settings in which occupational therapists can practice, we see a general high job satisfaction. In terms of salary, our starting salary can range, and with a current median salary of little over $93,000. To be an occupational therapist, you have to have either a master's degree or a doctorate degree. So you can have either degree level to enter the profession. In particular, our particular program at HPU, our HPU program is hybrid, and it's 105 credits total. As I mentioned, we have 2 different programs. There's one located in Honolulu and another program located in Las Vegas, and they're identical in terms of the curriculum, the number of credits, and basically the entire. So if you go to HPU's website, you'll see this part is identical. During year 1 is the didactic term in which you learn majority of the content that you need to prepare you for the clinical term, which is year 2. Because this is a doctorate degree program, we also have a capstone attached to our curriculum, and that allows the particular student to design a capstone project that's specific to their interest, and they work on that capstone project over the course of an entire year. So the pathway to our program, here are the requirements to enter our program, and all these details can be found on our website. So you need an undergraduate degree or 90 credits of undergraduate coursework. Here I have all the courses listed in which are required. Both programs do a holistic admissions process. So while GPA is part of the process, we also examine other opportunities like experience, which was also mentioned already in the presentation as an important element to consider. And so we do look at other aspects to each applicant as they apply to the program. So here is our QR code if you have additional, if you'd like to seek out the resources to our program, and certainly if you have any questions, I look forward to hearing them today. So thank you for having me.
Thank you, Dr. Adi. I really appreciate it. So now, let's welcome Greg. And Greg, I'm probably going to tear up your last name. Is it SQ?
That's
Go
quite
ahead.
close. Yeah, ask you. You
Ask
get as
you.
close as anyone
Okay.
does.
I just
So
wanted to make sure
thank
I
you.
got it right. Thank you so much for joining us. Greg is the Director of Admissions for our Doctor of Physical Therapy program at Hawaii Pacific University. So he's going to be sharing what students should know when considering a career in physical therapy. Greg, the floor is all yours.
Excellent. Thank you very much, Dasha. So yes, I'm the Director of Admissions for the HPU Doctor of Physical Therapy program in Las Vegas. We do have DPT programs in Las Vegas as well as in Honolulu, similar to the occupational therapy program. So I feel like we're all kind of competing with our various rankings here, but physical therapy is ranked number 3. At least it was a couple of years ago in 2023. I haven't updated this slide in a while, so I'll have to look at where we were in 2025. But it's consistently up there as one of the higher ranked professions within healthcare. And there is anticipated growth in the next few years. There is really a shortage of physical therapists nationwide, especially since COVID. There was quite a few PTs that left the profession, and especially in the Western United States, there's a very large need within the workforce for physical therapists currently. So there is a lot of opportunity out there for our students that are entering the profession in the near future. So physical therapists, what we do is our profession has really tried to brand itself as the movement specialist. So what we are in charge of is improving movement and function, decreasing pain so that patients can move better and therefore improve their day-to-day function. You will find physical therapists in hospitals or outpatient clinics, nursing facilities. You may also find them in schools, sporting facilities. There's really a lot of opportunities out there for different settings in which for physical therapists to work. There's quite a variety of specialty areas such as ortho, sports, geriatrics. There's also oncology specialties, cardiopulmonary. So again, a lot of different areas that you can go into as a physical therapist and specialize. Currently, a doctor of physical therapy, a DPT degree, is required. It has been that way for about 15 years now that the doctorate has been required. But we'll talk about a couple different options that there currently are in going about getting that DPT degree. So like I said, there is anticipated growth in the next coming years for the physical therapy field because of that need that is out there in the workforce. And the median U.S. salary per the BLS is $101,000. But that's really going to vary based on the specific state, specific region. But that give or take, that salary number is about where you'll look to be on average. And then again, there are a lot of clinical opportunities and options out there. So that's one of the great things about our field is just the different various options that you have once you get licensed to become a physical therapist. So I worked in sports when I was a clinician full time. However, as a licensed physical therapist, you also have the opportunity to go work in a hospital and work in acute care, or you can work in pediatrics with children. You can work with cancer patients in oncology. So once you get that license after graduation from a DPT program, you have really a lot of options on which ways you can go and maneuver within the profession. So a brief look at our program. So I had mentioned that there's a few different ways about going about getting a Doctor of Physical Therapy degree. So traditionally, the DPT degree took 3 years to complete, and there are still quite a few programs that are the 3-year traditional residential model. Residential meaning you go into the building each and every day. The HPU programs are hybrid and accelerated, and they are 2 years. So rather than the traditional 3-year model, these are 2-year programs that are hybrid in nature. So a lot of the lecture format takes place online with asynchronous and synchronous learning. And then our students go into either Las Vegas or Honolulu for 1 to 2 week lab immersions where they learn all the hands-on skills. So this is another alternative to the traditional 3-year model. It's 2 years rather than 3, and it's hybrid. So there is a lot of flexibility within that. But no matter where you go for your DPT education, a licensure board exam is required in order to become licensed and then be able to practice. So that's called the National Physical Therapy Exam, or the NPTE. And then post-graduation, there's lots of opportunities with residency or fellowship as well. So I do have the requirements for our program. I don't need to go into these extensively right now, but just know that you do need to take your basic sciences. Our minimum GPA is a 3.0, and that's pretty consistent with what you'll see with other professions, with other physical therapy programs. Highly recommend going to get some shadowing experience with a licensed PT. I would really recommend that for any profession that you're considering to go into. And while a lot of programs don't require those hours, I definitely would recommend it so that you have a good idea of what the profession looks like on a day-to-day basis before deciding to really dive in and commit to going and getting that degree. So here's a QR code just to get more information on our programs. And I have my email address as well as the Director of Admissions for Honolulu's email address on there as well. So thank you for your time.
Thank you so very much, Greg. And now I would like to wrap up our panel presentation. We're going to turn it over to veterinarian medicine with an international lens. So we're joined by Jessica Houston and Jeff Bates from GUS Medical and Veterinarian Schools. And then we also have Kelsey Tan from St. George University. Together, they're going to share collaborative insights on what it's like to pursue veterinarian education abroad and how their program supports students preparing for global veterinarian careers. So thank you all for being here, and I am going to let you go ahead.
Thank you so much. Yeah, so my name is Jeffrey Bates, and I'm actually the Vice President for Field Recruitment and Business Development for GUS Medical and Veterinary Schools. They actually own 3 medical schools throughout the Caribbean, and one of those schools is St. Matthew's University, which has both a medical school and a veterinary school. The reason why I'm here today is that I love helping students get into veterinary school. This really is my passion in life. I have been doing this now for over 20 years. I actually wrote a book a couple of years ago on how to get into veterinary school. So if you need any advice along the way, I'd be happy to help you out. I'm just happy to get you into any veterinary school, but obviously I'm here today to talk a little bit about St. Matthews. And you're probably wondering, well, where is St. Matthews University? And we are on the beautiful island of Grand Cayman. It's a beautiful Caribbean island. It's going to give you a similar type feel as you have in Hawaii. So beautiful beaches. It's very modern, up-to-date facilities. A lot of the stores and restaurants that you would recognize right from home as well, too. We were established back in 2005, and we now have over 400 graduates practicing not only throughout the United States, but throughout Canada and a few other countries around the world as well. We are currently in the process of gaining full AVMA accreditation. So we are listed with the AVMA, and I can talk to you a little bit about how that works. As far as getting licensed, it's really nothing too difficult as far as coming back to your home state as well. Oops, a quick little delay. So just a little bit about Grand Cayman. It is out of the Caribbean islands, one of the lowest crime rates on the island. The country does speak English as their primary language. Temperature is very warm throughout the year, between 70s and the 80s. So it's a beautiful, beautiful place to live and go to school. Lots of things that you can do around the island, obviously diving and just exploring. It is really well known for marine life. We do have our dean of our veterinary school is very much interested in marine medicine. So she will take you to Turtle Sanctuary, check out the stingrays, a bunch of stuff like that. So we can give you a lot of hands-on experience with marine animals, as well as all other types of animals as well. What you should know about our program is that it is an accelerated program. So where most veterinary schools are 4 years in length, you can complete ours in about 3.5 years. So it does save you about 6 months of time. Our class size is very, very small compared to most veterinary schools right now. Typically, it's going to be 45 students or less in your class. So because of that, we're really able to give you one-on-one experiences with our professors, a lot of interaction with animals, a lot of hands-on animal experiences along the way. And we do have 3 incoming classes as well. So flexible start dates, depending on when you wanted to start veterinary school, you can actually start in January, May, or September. And as I mentioned, lots of hands-on learning right from day one. So we actually partner with a lot of different places throughout the island of Grand Cayman where we can bring you to get hands-on experiences. So it's in vet clinics and animal care sites. We do have equine facilities where you can work with horses. And right on our campus, we are utilizing a lot of new VR technology for classes like anatomy, which is really cool to check out. I'm sure a lot of you have already played with VR technology, probably for gaming and other stuff along the way. But what you're able to do with VR technology nowadays is incredible. And you're finding a lot of medical schools and veterinary schools are starting to use that in their education. It's a great way to actually get hands-on learning in a virtual setting, but you really feel like you're right there interacting with everything. What I do want you to know about us is that we really are dedicated to your success. So there's lots of student support throughout your time with us. So we really want to find out what type of learner you are. Not everybody here learns the same way, remembers the same way. So we can really help you figure out what is the best way for you to study as an individual and create studying skills geared towards you as a person. We can help you with time management skills, test taking skills. And we have a lot of faculty advisors, peer mentoring along the way, teaching assistants that are all there to help you. And remember, our class sizes are less than 45 students. So all of our faculty members are really going to have the opportunity to get to know you personally, help you. You're going to be able to approach them. They set aside a lot of office hours after classes where they can really assist you if you need help. So all the support is there for you throughout your time. On our campus, you have a lot of clubs that you can join as well. I know a lot of our graduates go on to actually own their own veterinary clinics along the way. And so I always ask those students, are you looking to own your practice one day? Well, if that's yes, well, what business skills do you have, right? You probably didn't get much while you were in a pre-vet program. So we do have a business club on campus that brings in a lot of guest speakers, and we can start teaching you those business skills as well. But there's a lot of separate clubs. I won't read the whole list to you, but pretty much no matter what your interest or background is, we have a club on campus for you to join. And then what's exciting is that you can do your 4th year clinical rotations at any one of our affiliated AVMA accredited schools in the United States, in Canada, and we even are affiliated with the University of Edinburgh in Scotland. So some unique opportunities there for you as well. So your 4th year, your last year of veterinary school, where everybody's doing those clinical rotations, you're going to be doing them side by side with students who went to any one of these veterinary schools, getting the exact same training that they are getting. So some great opportunities there for you as well. And then because we are currently not accredited, our graduates right now have to go through the PAVE program, which is pretty simple. So you're basically doing 7 semesters of basic sciences, just like you would at any veterinary school along the way. And then before you go on to your clinical rotations, you do have to take the PAVE exam, which is a 300 multiple choice examination that's pretty much testing you on everything you should have learned in your first basic, semesters of basic sciences. So students do very, very well with that. Then you go on to do your clinical rotations at an AVMA accredited school. And then you sit the NAVLE exam, which is the North American Veterinary Licensing Exam. So no matter where you go to veterinary school, everybody sits that exam. So that's the same. And then you would have to take a state exam as well, wherever you want to practice. And that's the same no matter which veterinary school you go to. So basically, the only difference at this moment is that our students are required to take an additional 300 multiple choice examination that's testing them on their first years of basic sciences. So basically, if you have been doing well with us, you're going to do well on that examination. So these are all the states that do accept the PAVE. So you'll see pretty much every state in the United States does accept that. Hawaii is on that list, all of Canada, even Australia, New Zealand accepts the PAVE as well too. So it's very easy to come back home and get licensed after graduating from our program. And just a couple more slides, I'll be really quick. We do want to make sure your education is affordable. We really are committed to helping students. So we do have a lot of scholarships and grants available to our students. You can actually get up to $70,000 towards your tuition to come to school with us. And you'll see our tuition on the right-hand side. We are trying to keep it fairly low for most students. So we're very competitive with that of the other veterinary schools. And lastly, we have a great partnership with Loop Abroad, who some of you may be familiar with already. Loop Abroad is this great organization that offers pre-vet students a chance to get hands-on animal experiences literally all over the world. They can bring you to like 15 different countries with some really, really cool experiences. If you actually take part in any of the Loop Abroad programs, and you get a letter of recommendation from the veterinarian during that trip, if you apply to us, matriculate with our program, you will automatically be eligible for a $10,000 scholarship. So that is great. I have known about Loop Abroad for many, many years, and the quality of students that come out of their program is amazing. They give you a lot of life experience as well as animal experience. It's really a great opportunity for students who are looking to get hands-on opportunities. So check them out as well. And again, if you go through one of their programs, you actually can get a $10,000 scholarship matriculating into us. We actually work with all of their students who are in Thailand right now. Over the summer, we're giving presentations to all those students on just how to get into veterinary school. So if you do have any more questions, feel free to take a picture of this screen. There's a couple of QR codes that will bring you to our application. Ruby is the person who typically does a lot of the veterinary recruitment for us. She's actually located in Canada. It's a big holiday today in Canada. So that's one of the reasons I hopped on. With me today is Jessica Houston. She's located in California. She has the whole West Coast, so she can be a great resource for you as well. In the chat, she's probably going to put in a little link as well too, where if you do want to get a little bit more information from us, you can fill out a very, 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 very quick form, and we can put you in contact with an admissions advisor, some current students if you'd like as well too. So that's it for me. Thank you so much for your time. I really appreciate it.
Thank you. And just so you know, we have slides that we will send to everyone. So all the presenters should be giving the slides as well. Okay, moving on to St. George University. You're ready. The floor is yours.
Perfect. Thank you so much. I'm excited to chat with you all. I know, again, you've heard a lot about a lot of wonderful programs. So this has been fun to hear from everybody. So my name is Kelsey Tan. I work for St. George's University as the Associate Director of Admissions. I am based in Northern California, and I'm really excited to just touch quickly on our DVM program. St. George's University is located on the island of Grenada. So Grenada is the most southern island on the Caribbean island chain. It's right above Venezuela. It's also an English-speaking country. Our university is a full university, which means we have a lot of different great student support services available for you. A lot of really fun ways to get involved, lots of clubs and organizations, lots of fun things to do around the island. We are AVMA accredited, which is really great. We'll talk a little bit about all of the different opportunities that you can get through St. George's, but we've been around for quite some time. We have over 2,700 graduates who are practicing all over the world in all different types of specialties. So it's really wonderful to hear from them. We have a few upcoming virtual events. So if you want to connect with me today after this event closes, I'd be happy to share more about some of those virtual events coming up with some of our graduates. Like I mentioned, we have a lot of wonderful early hands-on opportunities for our students at St. George's University, starting off right in our small animal clinic. It's the only emergency clinic on the island, and it's open 24/7. So you get a lot of very unique experiences working, training alongside the DVM that are working here. You also get opportunities with large animals. So not only small, but also large, participating in ambulatory rotations, where you get to visit local farms around the island of Grenada. And then there are a lot of really wonderful, unique opportunities due to our wonderful location. I'm sure you can imagine marine life is very prominent, and there's a lot of fun ways to get involved, one through our Exotics and Wildlife Society, and again, through many other clubs and organizations that we do offer. The way that our program is structured is we have a 4-year DVM program. The first 3 years of that program are on the island of Grenada, and then for your last year, you get the chance to choose from one of those 30 plus clinical affiliated universities, which you can see listed here. We have a few new affiliates that we are very excited about, Colorado State and UC Davis, which are wonderful. So lots of different opportunities for you depending on your area of interest, depending on maybe the caseload that you're looking at. I think it provides students a really great opportunity to learn from more professors, interact with more classmates, and then just have a really strong network when you graduate of veterinarians who are practicing all over the world. Here's another brief look into the structure of our program. We do have 2 classes. We have a January and an August class. Both of those classes have around 180 seats, so there's no real difference as to when you apply, just the time of the year. Just quickly, I believe my presentation is lagging a little bit, but that's okay. I just wanted to share my contact info. I know we are out of time, so I'll put that in the Q&A. I'd love to talk more about the application process. So if you have questions, you're welcome to reach out to me. But please know that I'm here to help. I'm happy to help and just excited to be here today. So thank you very much.
Oh, thank you so much too, Kelsey. I just want to thank all of our panelists here. I know that you guys have been putting questions in the Q&A chat, so that's great. I'm going to open the floor up. I know we're getting close to 2:30, but we're here to stick around a little bit if you have additional questions that have not been answered in the Q&A. And just again, remember, I am requesting slides and all information from all of our presenters today, so I will send a follow-up as well with those slides. And then also just a quick reminder too, you can stay connected by following us on Instagram, Facebook, and then we'll also stay up with our newsletters to stay updated. So last but not least, check our PAC presentation library to rewatch any of these workshops too as well. So again, mahalo to all the panelists. And if you guys have any more questions, I am here to open the floor. Okay. I know that there's been quite a few before. I mean, and again, I just again want to thank every single person here today. We were jam-packed, and I know it was like giving you 5 to 6 minutes to speak, and it's been a lot. I hope that this presentation was a lot of information. Let me just make sure that some things didn't end up in other areas. Hold on one sec.
Joshua, I think there are some questions in the
Do see some
Q&A.
right here. Yes. So,
Yes.
okay, Anne just has a question for HPU. She wants to know the main difference between the physical therapy and occupational therapy. And you definitely got to meet with us too here at PAC because we do go through a whole lot of that exploration and we do have information because that is such a common question. But if anybody wants to answer that and give a short spill on that.
Yeah, maybe I could start, and certainly Dr. Askew can pipe in. You know, this is a common question as practitioners that we get asked pretty frequently as well. I think when you look at the approach of how occupational therapy is looking at rehabilitation, for example, because those are spaces in which we work at, um, we're focusing on the function of what is meaningful to the client. So that is, what does it take for a person to return back to school? What does that look like for a person to return back to caring for their loved ones if they've had some sort of injury? And we'll evaluate that from a cognitive well-being and physical aspect. So we look at the whole person, not just the potential debilitating motor aspect that it might create. I feel like physical therapy and occupational therapy are complements to one another, that they complement each other. So physical therapy, I see as my partner in healthcare, as their focus is very different. They're looking at the physical aspect of one's ability to participate and function. So while we might be heading towards the same goal, I think that how we approach the goal is different. Greg?
Yeah,
Thank you.
I don't have much of a counterpoint there. I think you covered that pretty extensively, Dr. Addy. So yeah, physical therapists are, again, try to brand ourselves as the movement specialists. So analyzing movement, how that affects a patient's function, how their pain may affect their movement and function, and returning them to their prior level of function.
Thank you so much. And it looks like, Anne, I know that I see Dr. Young answering some of the forum questions. So just definitely check the chat. Yep, I see that. I do see that there was a question for pharmacy, which was what is DKIP's accreditation status?
We just got our accreditation, re-accreditation notice. So we were going up for accreditation this year, and we were awarded another full 8 years, which is the max.
Thank you.
I was also answering the other question from Anne. It was taking a little while. It might be faster if I just say it verbally. But difference between nursing and pharmacy, there's quite a bit of differences. One is there's a lot more training behind the medication, so you're the medication expert as a pharmacist. You have less, probably overall less direct patient care time because you're doing other things. So that that's something that a lot of people who want go into nursing go into it for is to be with the patient. You're that patient's advocate. Pharmacists are too, but a lot of times in the hospital setting, they're with the medical team, or they're working on dispensing, preparing medications as well on top of that. But I would say because of that, there's probably a very good work-life balance with a lot of pharmacy positions. Especially now after COVID, there's been an increasing amount of working from home in different pharmacy positions. And so there's that. It's a lot less physical burden than nursing. Um, I think although the pay, you start out more as a pharmacist, but as a nurse, if you wanted to move up to APRN, I think in Hawaii, APRN's a very good, so advanced practice nurse would be a good pathway if you wanted more abilities to prescribe and diagnose. Um, so it's kind of similar with PA, but you would be able to get to the APRN route if you went the nursing route.
Thank you so much. And it looks like Ashley has a question. She says if she's looking for starting a job opportunity to help get into PA school or pharmacy, where should she look and apply? I would just start off by just saying to Ashley, we have a lot of information on our PEC website for different areas of opportunity to get some experience. So if you have additional questions, feel free to schedule an appointment with us too, and we can share some of our contacts and different ways you might look at getting started. But if anybody else wants to, I'll open the floor if anybody else wants to add any questions in specific to pharmacy or PA.
Yeah, I would say while you're an undergrad student, there are a lot of ways that you could get your feet wet, so to say. There's things like I'm sure Dasha has access to things like the COPE Health Scholars. Hawaii Pacific Health has different research scholar programs that you can start to do. I also saw that there are some like medical assistant trainings that happen while you're in undergraduate. So I think those are good ways to get your foot in the door. But then again, going to each individual program has what qualifies for direct patient care experience for PA, and that varies. Some will take volunteer and shadowing and research and clump it all into one, and some will instead it'll have to be like a paid position. So you might need to first get a certification as a medical assistant or a nursing assistant or an EMT, first. So I would look at each individual program.
And I would also add that I think it's important to figure out also the pathway that you're wanting to go into. So maybe digging deeper with the career exploration part, because, as Shayna was saying, different programs require different hours and different levels of experience. And as you'll find, PA definitely requires a diversity of experience and hours, and also depending on what school you want to attend. So it's a lot to unpack, and it's not just kind of a cookie cutter way of thinking. So that's why it's really good to kind of brainstorm and meet with us. But one thing that I will say is shadowing is probably going to be your best experience first to find out and shadow different areas. Even if you're kind of in the place of career exploration, shadowing would be great so that you can get a better idea of where it is that you're thinking you want to go. And then from there, we can look at the requirements for the programs and then break it down to like what schools you're looking at. So it's a process, but shadowing, I think, would probably be a good place to start just to find out where you're thinking, like where you want to practice and what you want to do.
So the Queens Medical Center has a volunteer program too, and it's kind of geared for pre-health students. So there's a lot of young people. If you can commit a certain amount of time, then they'll write a letter of rec for you. That's what they tell you when you sign up. You can also reach out to me if you're interested in pharmacy. We have classes for fourth year students on rotations, and allow we welcome people to shadow if you're interested to learn about different areas. We have a classroom near the medical school in Kaka'ako. And I also have information if you're interested in part-time work as a research assistant doing studying pharmaceutical drugs. So that could be a good option. Also, just working part-time as at a pharmacy as a technician, which you don't need a technician certificate to do in Hawaii. That's also a good pathway to go into pharmacy.
I just want to kind of hop on as like the student experience portion of it. To kind of second what Dr. Young said, I was a Queens volunteer and they have some really great programs. Their volunteering program allows you to go to different areas of the hospital, get a little taste, and do some like small, simple tasks for them, which is really great. But speaking to like experiences like direct patient care hours, as Dasha said, staying in contact with like our newsletter or Instagram, we get job opportunities that come into our email and we put that on our Instagram. A lot of the times they're like medical assisting jobs and they don't necessarily require any medical certifications and they'll teach you on the job. I have a bunch of friends who just followed our Instagram and that's how they got their medical assisting jobs and that's how they're getting their hours. But for me specifically, just asking, kind of being at the right place at the right time. I ended up working at my grandparents' doctor's office as a medical assistant, so you never really know with any opportunity unless you ask. So don't be afraid to ask around either.
Yes, thank you, Lauren. Any additional questions? I mean, I definitely think there's a lot of information. And again, the great part about it is collaborating with everyone. We get a lot of this information that's sent to us, and then we do update that on our newsletters. And if you have any questions and you do want to follow up with us about any of the panelists, any other questions, please feel free to schedule an appointment with us, check our newsletter. Just stay up to date with everything because it's all about really helping you get exposed and knowing all the different opportunities that exist within the health career space. So I really appreciate everyone. I know we went over and time is valuable. So thank you so much, everyone, for joining us today. Again, if you have any additional questions, feel free to reach out to us. Also, social media, you can join our Facebook, our Instagram, any newsletters. And then again, I will also send, thank you guys. I'm getting slides already coming to me. So I will make sure that I get all of those updates and get that out to everyone that's attended today. And then the presentation as well. I'll send you the recording and it'll also be at our presentation library. If you want to know more about more student experiences like Lauren shared, we do have a past panel discussion with students that actually represented a majority of the programs that you see today, and they discussed those experiences. So feel free to go and look at that recording too for our past student panel in regards to different health careers. Again, thanks for joining us, and we look forward to, we have one more for the summer, and it's all about majors. So if you have any questions about what majors you want to, you need to take to set you up for success before you go into these professional programs, join us next week, next Tuesday, and we look forward to seeing you again. Take care. Bye-bye.
Thank you.
Thank you.